Greetings of the day. I am Dr. Anusha and today I will be talking about muscles of mastication and structures that are seen in infratemporal fossa. There are four muscles of mastication: masseter, temporalis, medial pterygoid and lateral pterygoid. Masseter, it is a quadrilateral shaped muscle. It has superficial fibers, intermediate fibers and deep fibers. Superficial fibers, they take their origin from the anterior two-thirds of the lower part of zygomatic arch, whereas intermediate fibers, they take their origin from the lower border of posterior one-third of the zygomatic arch. Deep fibers, they take their origin from the deep surface of zygomatic arch. The fibers will pass downwards and laterally. The superficial fibers are inserted onto the lower part of the ramus of the mandible, and intermediate fibers, they are inserted onto the middle part of the ramus of the mandible. Deep fibers are inserted onto the upper part of the ramus of the mandible. Temporalis. Temporalis muscle, it will take its origin from temporal fossa as well as temporal fascia. The fibers converge to form a tendon, and this tendon will pass beneath the zygomatic arch and are inserted onto the coronoid process of the mandible. Medial pterygoid muscle. Medial pterygoid muscle has superficial head and deep head. The superficial head will take its origin from the tuberosity of maxilla, whereas deep head, it will take its origin from the medial surface of the lateral pterygoid plate. Both superficial head and deep head will pass backwards and are inserted onto the inner surface of the ramus of the mandible and to the angle of the mandible. Lateral pterygoid muscle, it has upper head and lower head. Upper head is small and it is taking its origin from the infratemporal surface and crest of greater wing of sphenoid, whereas lower head, it is taking its origin from the lateral surface of lateral pterygoid plate. Upper head and lower head, they are inserted onto the neck of mandible and anterior part of articular disc of temporomandibular joint. All muscles of mastication will elevate the mandible except lateral pterygoid, which will depress the mandible. Posterior fibers of temporalis will retract the mandible. Both medial and lateral heads of pterygoid, when they act together, they help in the protrusion of mandible. Elevation of mandible means closure of mouth, and depression of the mandible means opening of mouth. TM joint or jaw joint, temporomandibular joint, it is a condylar type of synovial joint. The articular surfaces are: the articular surface above is articular eminence and mandibular fossa, anterior part of mandibular fossa, whereas below it is by head of the mandible. What are the ligaments we see in the TM joint? Ligaments of temporomandibular joint. There are four ligaments. One is fibrous capsule, stylomandibular ligament, spinomandibular ligament and lateral ligament. Fibrous capsule, it will encircle the joint completely. Above it is attached to the entire circumference of mandibular fossa, articular eminence and squamotympanic fissure. Below it is attached to the neck of the mandible. Lateral ligament, it is attached above to the articular eminence and below to the neck of the mandible. Stylomandibular ligament, it is attached to the tip of styloid process to the angle of the mandible. Spinomandibular ligament, the attachment above is to the spine of sphenoid and below is to the lingula. Articular disc, it is a oval fibrocartilage which will divide the joint cavity into two compartments. Upper compartment is meniscotemporal compartment and lower compartment is meniscomandibular compartment. In the upper compartment, gliding movements will occur, whereas in the lower compartment, rotational movements will occur. And the attachments of this articular disc are: anteriorly it is attached to the inner surface of fibrous capsule, and posteriorly this articular disc will split out into upper band and lower band. The parts of articular disc from anterior to posterior are: anterior extension, anterior band, intermediate zone, posterior band. This posterior band, which is dividing into upper lamina and lower lamina. In between upper lamina and lower lamina, venous plexus are seen. Mandibular nerve, it is the largest branch of trigeminal nerve and it is also nerve of first arch. Since it is a mixed nerve, it has large sensory root and small motor root. Large sensory root is coming from trigeminal ganglion and small motor root is coming from pons. Both sensory and motor roots, they emerge out through mandibular foramen and are seen in the infratemporal fossa. What are the branches from the trunk? Anterior division and posterior division. From the trunk of mandibular nerve, two branches are given, one muscular branch and one meningeal branch. Muscular branch is given to medial pterygoid and meningeal branch we call it as nervus spinosus. And few branches from the trunk of mandibular nerve pass through otic ganglion without interruption and supply tensor tympani and tensor valley palati muscle. From the anterior division of mandibular nerve, three muscular branches are given and one sensory branch. One sensory branch, that is buccal nerve, and muscular branches are given to masseter, temporalis and medial pterygoid muscle. From the posterior division of mandibular nerve, auriculotemporal nerve is given, which is splitting to enclose middle meningeal artery, inferior alveolar nerve and lingual nerve. This inferior alveolar nerve is in turn mixed nerve, is passing through inferior alveolar foramen, inferior alveolar canal or mandibular canal, and is supplying the molar tooth, incisors and supplying dental plexus. While it is passing through mandibular canal, it is supplying the mylohyoid muscle and it is emerging out through mental foramen and supplying the skin over the chin, and it is dividing into mental and incisive nerve. A 27-year-old girl went to dentist for regular checkup. The doctor had discovered her third molar tooth to be erupting and he recommends that she can have it extracted. She agrees and returned the following week for the procedure. The nerve supplying the lower jaw was blocked with anesthetics. The girl experiences numbness in her tongue and lower lip. Which nerve needs to be anesthetized in order to prevent pain during lower third molar extraction? Inferior alveolar nerve needs to be anesthetized in order to prevent pain during third molar extraction. While extracting lower molar, while patient's lower lip and tongue are numb following nerve block, it is because inferior alveolar nerve and lingual nerve are in close proximity. Some patients occasionally experience temporary paralysis of muscles of facial expression or mastication following dental procedure. Why does this happen? When large amount of anesthetic agent is given, sometimes it may diffuse through parotid gland and within the parotid gland facial nerve is present. So that is the reason for the temporary paralysis of muscles of facial expression. When dental work is performed on lower tooth, anesthetics injected at single point often is adequate to produce complete anesthesia of all tooth on a given side. The same is not true for upper lip. Why not, and how is it anesthetized then? The tooth of upper jaw are innervated by series of branches from maxillary nerve. There is no convenient way to anesthetize entire maxillary nerve. Instead, nerve to each tooth must be anesthetized by injecting anesthetic agent into gingiva of each tooth. Thank you.